We have our patient in the chair. We make a diagnosis. We send them off to the specialist for some work to be done. The specialist sees something else that needs to be done. Oh, no. The specialist, instead of doing $1,500 worth of work on our patient where only $700 of a $1,500 maximum allowable benefit gets taken up, the specialist does $3,000. And now the majority of our patient's insurance benefit has been taken. What will we do? Now we get upset with that specialist. I didn't tell you to do that extra work. Are we treating the whole patient? Are we taking care of that patient? And our patients can afford dentistry when they understand the need for the treatment. We need them to understand that they need to spend their discretionary funds on their oral health care in our practices. And when the patient understands that, they're happy to pay for those things they understand. It's not about the insurance. It's not about treating to the insurance company. And the opioid usage in this country, oh my gosh. We have RX'd opioids like they're at the candy store throughout all these years. And I'm so grateful. I have been one of those docs that have I've not prescribed opioids. Addiction, I've had family members who are addicted to drugs, and man, I have been so tight on my delivery for any kind of addictive drug since the time I started practicing. And I'm grateful that there is this awareness now across our nation that we can actually get our patients through that 72-hour pain threshold, and one of those pearls of wisdom will be talked about today with my good friend, Dr. AJ Stosich, who we interviewed, and that's where our podcast begins right now.
Computers are live, mixers up, levels are good, equalizers good, ready channels 1 and 2. Mic is live in 3, 2, 1, roll it. Welcome, listeners, to the My Practice, My Business podcast, where we teach dentists and their teams how to reclaim forgotten profitability in dentistry with our clinical business of dentistry training. And now, the host of our show, the clinical director at My Practice, My Business, Dr. Rob Thorup.
Welcome, podcast listeners. It's Dr. Rob with My Practice, My Business. Thanks for joining us today. I'd like to introduce our guest. This is Dr. AJ Stosich. He is one of the owners of Aspire Oral Surgery here in Salt Lake City, Utah. They've got about 7 facilities throughout the Wasatch Front. And glad to have you here, AJ. How you doing today?
Thanks, Rob. This is really a great opportunity, and I'm doing well. Fantastic to be here.
That's awesome. Hey, I just want to give them my story about how you and I hooked up. As everybody knows, that I'm a general practitioner, and how I started referring to Aspire Oral Surgery many years ago. AJ, how long have you been practicing now for?
You know, I've been in Salt Lake City for about 12 years.
Wow, 12 years. So what's really awesome is I know AJ's parents, and who supported him and gave him all of his smarts to go through and become a doctor here in the Valley. And let me tell you about AJ. AJ is an oral surgeon, and he's got both his doctorate of dental surgery and his medical doctor degrees, which is either tells you that he's crazy or he just loves school and loves to study. Which one is it, AJ?
You know, you could say it's a little bit of both for sure. Definitely more on the crazy side, my friend.
That's awesome. So I took and when AJ first started practicing, his parents, I've known his parents forever. They live in my neighborhood, and his mom was like, "Hey, Rob, you've got to refer to my son, and he's awesome." And I'm like, "Yeah, I know." In my building out here in Cottonwood Heights, we've had an oral surgeon in our facility for years, and I'm kind of like, I know I should do it. And finally, after AJ's mom left a couple of years later, I'm going, I've got to give Aspire a try and give Dr. Stosich a try. And man, AJ has been great ever since. And that's that's kind of the story in a nutshell. But I want to tell a story about one of my patients. And this is really important. And this is going to kick off the area that we're going to talk about today.
All right. Well, good. I hope this patient had a good experience, Rob.
Yeah, you might want to sit down and maybe lay down. No, I'm just kidding. So here's what's really cool. I sent this patient was going to another oral surgery practice that I referred to. And he wanted another referral just to have a something to compare with. And you know how patients are. They're always doing that. And so I said, hey, I think you need to go over to Aspire Oral Surgery. They're over here in the office where Dr. Stosich is working, is in Murray, Utah.
It's in Murray, actually. Yeah.
Yeah, in Murray. Go get have him give you an opinion on what he wants to do, and then report back to me. Let me know what your experience was with both offices. Long story short, and I hope everybody's listening to this. Long story short is, we'll just say office number 1 that he originally went to, gave him a treatment plan, good, solid oral surgeon. I like him, and gave him a treatment plan. And then as the patient told me, he said, Rob, he gave me this deep discount. And I mean, he knocked off thousands, AJ, thousands. And he said, yeah, kind of like, and I said, and my patient asked the oral surgeon, why did you knock off, thousands of dollars on this treatment? And it was for, several implants, bilateral, sinus lifts. And he said, well, there's oral surgeons on every corner here in Salt Lake, and I want to make sure that I get your business. This guy is pretty business astute individual, which most patients are becoming, AJ. And I said, and then he said, then I went to Aspire Oral Surgery, and he said, Dr. Stosich was very thorough, informative. I went out front. I didn't just get something that showed codes and descriptions, that's his words, not mine, and fees attached to them, but they gave me documents that explained what a sinus lift was. They gave me documents that talked about the type of implant that they wanted to use, which is Straumann, which I'm so grateful you guys use all the time, because otherwise we'd have a different conversation. But Dr. Stosich has used Straumann implants for years. And from a restorative point of view, I love restoring on them. I do not like restoring on so many other different types of implants that are out there. When it comes to the restorative end, when it comes to the overall everything from you, AJ, from the placement to the patient experience. Anyway, this patient of mine, he came back to me and he showed me the pricing. And you guys were identical in pricing, almost identical. And he said that, but Dr. Stosich gave me information, took the time to explain things, and his staff was fantastic. They gave me documents, which were documents out of my dental docs. He actually brought them in and showed them to me. And I'm like, yeah, those look familiar. Anyway, and then he said, I feel good about going to this guy. And he said, he didn't give me a discount. He's more expensive because there is no discount, but I'm choosing him because of my experience. Because of my experience. And as you know, AJ, we teach all about that Disney experience, giving the patients that Disney experience and a reason to return, and giving them choice, when they come to your practice. And that's a live story, and that just happened a few months ago. And that's what, for me as a GP, that's what I love to hear about when my patients give that kind of report back. That's the kind of specialist that I love referring to. And what's really tough for me, and we're going to go with this, is why do we treat, and many specialists, why do we treat to the standards of dental insurance? Why is it that we do that, AJ? What do you see on the specialist? Why do sometimes we see specialists treating to dental insurance instead of treating the patient and being paid fairly for what you guys do. What's your thoughts?
Well, Rob, first of all, I'm glad this patient had a good experience. And second of all, I'm certainly glad my office staff handled that well, or maybe we wouldn't be having this conversation. But, over
By the way,
last 12 years.
Hey, AJ, all of my patients that have been going to you guys have your systems in place, because it doesn't matter what facility they've gone to down in Lehigh, up in Sugar House and at Murray. Those are the 3 locations they've used. They've had the exact same experience. So kudos for you putting and implementing policies, procedures, and protocols. That's awesome. So keep going. Sorry, I didn't mean to interrupt you. Go for it.
No, I appreciate the feedback. I mean, we work so hard to help standardize just the best quality of care for people. And, as you can imagine, doing that in 7 offices has been quite a learning experience for us, but we're getting there. There's always things we're changing, but we love it. We love what we're doing. Well, back to your question, it's interesting. In the last 12 years that I've been practicing, as you have noticed, I have learned a lot about business, and you've probably learned a lot about business in your years of experience as a dentist. And, it's very easy to let insurance companies run our lives. It's almost like they set the standard of what we should charge, how much we should charge, what procedures we should do, what procedures we shouldn't do. And we almost think that we need to lay this on patients. And that has been a very difficult thing for me to overcome over the years, is just figuring out what the balance is. I mean, you want to treat your patients fairly, and you want to be treated fairly by your patients. Right. You want to be treated fairly by insurance. And the bottom line is, I'll just speak frankly, insurance is never going to treat us fairly over time. And so, I think that it's in all of our mindsets that we need to charge a specific amount of money because insurance sets a standard. And we think if we're much above that standard, then we're overcharging, or we're going to damage our reputation by being more expensive than the next guy. And I think we've got to get away from that. I think we've got to learn to be quality in our practices. And we've got to learn that we have been trained in exceptional ways to do very good things. All of us. There's not anyone who hasn't gone to dental school that hasn't experienced this in their own practice. Everybody works so hard to get where they need to be. And so it's saying, okay, what am I worth doing? What's it worth it to me to do this procedure? And what's it worth the patient to do this procedure? And how are we going to make that happen? So
the question I have for you is when you do that and you want to provide the best, just like the ADA came out at the beginning of the year and they talked about they were talking about insurance and all that the ADA is doing for us with insurance companies. But many of the complaints were, how do I maintain a high quality practice at insurance reimbursement rates? And without going into detail and spilling our secret sauce in our training, what is it that you learned about being able to offer choice to your patients and use the better implants, use the better bone, use the more expensive products? What did you learn, and how has that been affecting your guys' practices so far?
Well, Rob, if I can maybe spill a secret or two, I don't know, but if I get a little out of hand, let me know.
Okay.
But what I enjoyed about meeting with Rob and my practice, my business, was the pure understanding of the law with insurance. And that I actually could use the top of the line products, which I have always tried to use the top of the line products, but that I actually could use the top of the line products and not suffer because of the reimbursement from insurance companies. There is a way that patients can have the best and they can have their cake and eat it too, and so can we. And we can all have a good experience in the process rather than stress about what the fees are and what the insurance is going to reimburse me for paying. I'm paying an exceptional amount of money for a Straumann implant, and what's the insurance going to pay me because I'm using that implant? Maybe I should go use the cheapest implant so I can have better margins. Those thoughts cross your mind.
Absolutely. They do every GP. It's way more expensive for us to buy those, but it is still more expensive for you to buy a Straumann or any of the other higher end implants versus the other types of implants that are out there. Neodent.
Absolutely.
And Implant Direct and Southern. There's a bunch of implants out there that they're chasing that market that's the inexpensive market versus Straumann, Nobel, other types of implants like them there. And then there's a bunch of middle grade implant pricing that I'm seeing out there too. So it's like where there's a differential in cost of goods, dentists seem to keep their price point the same because they don't understand what their abilities are with the insurance companies. Now, I just want to come back to one more thing. When I send you a patient and that patient comes in and gets treated by you, okay, and you have a treatment plan that's $10,000 for a couple of implants, a sinus lift, whatever it might be, then what happens when that patient goes back to the GP? And I guess what I'm getting here is what concerns you the most as a specialist with your referring base? And has a GP ever been upset with you because you've spent all their patients' insurance money when I'm going right back to the question, why do we treat to insurance? Why don't we offer the patient the choice? And aren't patients, the majority of them, large majority, able to find ways to pay for their dental care? I mean, to me, that's what stresses specialists out the most is GPs getting upset because you've used up all the dental insurance. You ever have issues like that from time to time?
Oh, for sure. I mean, it doesn't happen frequently, it seems, but perhaps I'm also not understanding all the frustrations from the GPs. I think the doctors I work with really close are very quick to call me when there's a problem. And even sometimes they just let things roll over. But I think you're hitting the nail on the head with a lot of specialists. If you consider what items you refer out to specialists, you realize, that's going to consume all of the patient's insurance, and then some for the year. That's probably exactly typical with a root canal. It's typical with a extremely difficult prosthetic case to a prosthodontist. It's typical with, even a set of wisdom teeth or a couple of implants. So, right. I think there's a problem and a dilemma we deal with a lot. And yes, I get concerned about this all the time. And I want, the GPs that work for me also to have the same ability to use the insurance that I do. So it's finding that, it's defining that fine line. How do we help each other?
Exactly. And what it comes down to is lack of business training on everybody's part, because if we're able to present treatment in a way that patients, in a way that it competes against corporate America, in a way that it promotes oral health care and it causes the patient to spend their discretionary funds in our dental businesses instead of at Chills or Cabela's or Nordstrom's or somewhere like that. Isn't that where our focus should be? We're not really competing against each other. We're competing against corporate America in wanting to have that money spent there in our practices, right?
Oh, absolutely. I mean, most of what we do in dentistry is discretionary income versus, absolute need. And so it's helping patients, it's educating patients, it's allowing them to understand. And, that's been a big boon for us, using My Practice, My Business documents. Like this story you were explaining earlier of the patient. We have a lot of patients that use different products in our office because we supply them with these documents, and maybe I would supply them with another document that I could make myself, but these have been provided to us by My Practice, My Business, with some input on our
My
end.
Dental Docs, right? Yeah, My Dental Docs.
My Dental Docs, sorry, yeah. And those have been key in helping patients understand why we're doing what we're doing. And once they understand the why, then to them, most of the time, it makes a lot of sense.
Exactly. Hey, let's shift gears for a minute. What age do you like to see patients at to remove wisdom teeth? What's your standard regime? And I know a lot of docs out there that are going to listen to this podcast out on the East Coast and the Midwest. Oftentimes it's like, well, we don't remove wisdom teeth at will. We wait till there's a problem. I want to get back to that. But what age do you like removing wisdom teeth at? What age do you want me to send those patients to, just on an average?
Well, I don't know if it's an ideal age or maybe even just an ideal X-ray. Okay. So when you're looking at wisdom teeth, the consideration has to be, do these wisdom teeth, are they going to need to come out? And one thing you look at is what's left in this patient's growth potential. Do we think they're going to grow more? If they grow more, do we think there's going to be room for the wisdom teeth to erupt? Okay, so that's one thing you look for.
And usually we see that somewhere between ages 14 to 18. We usually are able to make that determination. So,
agreed.
Is it, age 14? I know some oral surgeons have like to take them out kind of before the roots grow. Others, it's like bring them on, whatever. What's your ideal situation?
To be honest, I'm willing to tackle a set of wisdom teeth if it's referred at almost any age, if there are good indications and if the indications are appropriate. But if you were to ask me the ideal, most likely somebody in the age range of about 15 to 18, where those roots are about 1/4 to 1/3 developed. So there's just a little root that's slightly developed on those wisdom teeth, and they're still impacted. Those are the easiest wisdom teeth to address. They tend to have the fewest complications in the future. Those roots are not intimate with that inferior alveolar nerve, and that makes it really helpful.
And recovery time's quick. And what are you doing to prevent dry sockets, especially in the mandible? That's always the worry that patients have, and the phone calls sometimes we get. What's your take on that?
Well, there's a couple of things. I read a study a few years ago on using preoperative antibiotics through the IV that had shown to be beneficial in prevention of dry sockets. So that's item number one. Number two is using PRF. And that's been also an interesting thing that we've added to our practice over the last year and a half. Extensively with wisdom teeth. And we feel like we've been seeing good results from it. Our results are anecdotal, but we feel like it's that we've seen progress with that.
That's awesome. And that's exactly what we're seeing with patients that are having that procedure done. And I'm like, bring it on, charge extra, make that patient, give them the best care, and make sure that they're not calling me, telling me that they have a dry socket or things are hurting. So that's always
the
nice.
worst thing is a dry socket on a Saturday night, right?
Exactly. So painful. What type, why do you use Straumann? Tell me why you use Straumann. There's a myriad of implants out there. What is it that you like about Straumann?
Straumann, there are several reasons I like it, but one of the things I really love about Straumann is they have been around for a long time. Not as long as perhaps Nobel, but they have been around a long time. It's a well-studied implant, and they have done their research. The thing I like about Straumann in some of their research that they've done is that their implants are actually shown to have integrated better than other implants that were studied against their own implant. Secondarily, I love the ease of restorability. I love that there are only 4 connection zones that you have to work with. I think it makes it so much easier for a GP. That's one of the things I liked about Nobel trilobe implants is there were only 3 areas that a dentist had before he could figure it out. But that was not a great platform, we learned. And so the benefit with Straumann as well is they have a conical connection. And the conical connection is shown to have fewer issues with abutments loosening over time. So I love the connection because it provides my GPs the opportunity to tighten an abutment and it never come loose again. And it can come loose again, but that's the idea behind the conical connection, and it's pretty rare. The other advantage is they have platform switching. So I know that I'm going to maintain bone and sometimes even gain bone after I've placed an implant. To me, that's huge, especially in the aesthetic zone. I love the surface of Straumann implants and, again, its ability to integrate with bone. So there's a reason that it's one of the Cadillacs of implants. And I'm a true believer in Straumann.
Yeah, I love them too. I've restored many implants throughout the years. And I need to give full disclosure. And I know that a lot of GPs are going to probably laugh at me a little bit, but that's okay. I probably in my career, I've placed probably right around, maybe 800 to 1,000 implants. And I just got to a point where, especially with the technology that you have in your office to be able to, use imaging, cone beam and imaging and a software to create stents and make sure those implants get placed perfectly. I just don't place implants anymore. It's just like I send them off to AJ and his team, depending on where my patient lives, and just let you guys do it. I don't do wisdom teeth either. You guys can take out a set of wisdom teeth in about 4.5 nanoseconds. It takes me, hour and a half, maybe an hour with some easy ones. And I've always been of the opinion, AJ, if I can't do it as good or better, laugh is better. If I can't do it as good as a specialist, it's like, why do I want to torture my patients? Why do I want to do that? And you guys do these procedures all day long. It's just like I do crowns. I do root canals. I tackle some perio cases. I enjoy that. I don't do ortho. The man upstairs made specialists for reasons. And I dabble in the areas that I see a lot of patients in, and I do a lot of work, and I'm competent in those areas. And that's like really important. But I want to ask you the difference though. I do take out teeth, and you know that. So if I'm going after a tooth, going after decay and it's non-restorable, it's coming out. And I offer my patients ridge preservation every single time. And what do you as a specialist, when you see my patients come in, there's a ridge there you can dance on. What goes through your mind when you see a patient come in for implants and that GP is really, has been placing bone, synthetic, bovine, whatever it might be, cadaver, but preserving that ridge versus patients you receive where no ridge preservation was done? What goes through your mind? Do you just kind of have some swear words that go on? Do you do some sort of dance in your brain? And what can we do as GPs to make sure you don't have such challenges?
Well, I'm grateful for when the GP looks at an extraction site and actually is willing to place a bone graft to apply the ridge preservation principles and help us out. One of the most difficult things that we have is going back in after the fact and doing a ridge augmentation procedure, whether it's harvesting bone from another portion of the patient's body or using cadaveric bone and using membranes and everything that we can to try and gain that bone back. Ridge preservation is awesome.
How expensive is it to go in and do that? I mean, way more expensive than just doing it right when the tooth comes out, I'm just assuming, right?
Oh, yeah. I mean, I would guess the differences in cost there are probably $1,500 or more. Wow,
that's crazy. Hey, tell the audience about Exparel and how you're using that. How do you apply that?
Oh, Exparel is awesome. It's it's Marcaine that's contained in what's called a liposome. going way back to physiology and cell biology. It's a phospholipid bilayer, like a cell membrane. And these little vesicles contain marcaine. And what happens is you can use this by injecting into the soft tissues around an extraction site or a surgical site, for example, and it slowly releases marcaine over about 72 hours. There's even been some evidence that shows that it goes even longer than 96 or even more than 100 hours, where a patient has the capacity to be numb in a surgical site. And it is awesome for wisdom teeth. We use it for prevention of using opiates. So, we're doing our job to try and prevent the opioid crisis, if you will.
Years ago, it's unfortunate, but we used to just hand out, Lortab or, Percocet at a regular basis. And so grateful that we've been educated and that's come to a stop. But what was really exciting for me is my patients talking to me about this special drug that you were using a long time ago. And boy, they just didn't have any post-op pain to speak of, and they loved it. And it was like, all they needed was Motrin or Tylenol to take care of any of the discomfort after that first 48 to 72 hours. It was amazing. And is that like a common procedure you do? Is that something you offer all your patients? Because I know that's not cheap.
Yeah, we offer it to every wisdom tooth patient and to every patient who's having a procedure that we think may benefit or that we normally would have prescribed a narcotic to. And it's amazing how many patients really like to use it, and the feedback from patients has been very positive.
Wow. Again, it's this value-added service that I really appreciate with Aspire Oral Surgery. And one of the questions I have for you is what do you do for your referring base to keep them referring to you? And that's just one example of many. But talk to me about, we just had a continuing education course with you guys. And how often do you do those? And what do you provide your GPs, your referring GPs? What do you do for them?
We love to be in that arena of continuing education, and we like to offer the practices that work with us different entities to do that in. Sometimes we'll do a fun place, and sometimes we'll do a boring place, but we try to find very good education for people who work with us, or we provide the education ourselves. We're doing an event coming up where we're going to be doing some mountain biking, some downhill mountain biking, and we're also providing the continuing education after we go on some rides, some downhill mountain bike rides. So, we do a lot of stuff to engage and meet with the doctors we work with, but not only that, and provide a little bit of fun, but not only that, provide a little bit of education. And so, I think if you could answer that question, what do you do to help maintain referrals? Well, the best thing we can do is be good quality surgeons. But along with being good quality surgeons comes communication. I think communication, probably of all the things that we do, communication with our general practice doctors and anyone else for that matter who refers to us is key. And so we try to get back to them. We keep them informed. We send them letters and faxes, helping them know what we're doing to treat their patients. And I think of all the things, that's probably the biggest complaint GPs have against their specialists is they don't know what's happening with their patient that they sent over.
Amen to that. We get a lot of phone calls from your office, and I love the over communication that takes place, because that's one of the key things. One of the things I enjoy working with you guys. I can't tell you how many times we refer a patient to like a periodontist, and we never see the patient again. We never see the patient until the periodontist sends them back, says, "Yeah, I think there's some decay here that you need to get taken care of." And it's like, hey, look, I've got hygienists. We tackle perio. Why? I just sent that patient over to you guys for a little free gingival grafting in a certain area, and then I never see them, and that just like kills me every single time. Of course, you guys, it'd be tougher for you guys to do that, but it's pretty funny. I love that extra communication you guys give.
I certainly can't say we've been perfect at it over the years, and that we've had a lot of failures and a lot of learning through that. And, even sometimes, admittingly, a patient will slip through the cracks. So we hate it when that kind of thing happens. But we do our best to communicate what's happening with patients. And, we hope that helps our general practitioners understand what's going on. And it's going above and beyond, but you have to do it.
So, AJ, if you could give GPs 3 jewels of wisdom, what would that be to our listeners that are out there?
I'm glad you asked me that question. I think if one of the biggest things I would appreciate is if my GPs would communicate to me if their patient has experienced a problem. I really want to know if my patient had an issue and I didn't hear about it, or I want to know if they're unhappy about something and I didn't hear about it.
That reminds me of a sign I saw in a business one time. It says, if you're happy with our service, tell others. If you're not, tell us. And that's so true.
Isn't that true? You just want to know if something bad happened and you don't find out about it.
You don't want to find out about it on a Google review, do you?
Oh, it's the last place you want it. And you also want to know where you're going wrong in your practice so that you can make changes.
Yeah, because none of us are perfect. We don't do everything ideal all the time. We wish all of our systems and protocols went well all the time, but it just doesn't happen all the time. What would be 2 other pearls you give them?
Another pearl, I don't mind when my GPs are doing oral surgical procedures. I'm fine with it. I think where I see them go wrong, and this pearl of wisdom, I think everybody has probably already learned that is listening to this podcast, is use good judgment before you jump into it.
Yeah, that we get that from Dick Engar with Professional Insurance Exchange, our medical malpractice insurance carrier. We hear that from him all the time.
Oh, I bet. I think that's where GPs go wrong. And then, lastly, never be afraid to call and ask a question. I'm always willing to answer questions from the guys that work with me, always. And I think sometimes people may feel a little bit sheepish or silly for asking a question or two. And I don't think that there's ever a problem with a colleague of mine calling me up and saying, hey, what do you think? Or what are your thoughts? Or what should I do?
Yeah, even if it's like for me, like taking a tooth out, sometimes it gets a little hairy in there. Taking out a root canal tooth that's been ankylosed for 1,000 years in my prehistoric patient. And there's times I go, wish I would have just sent this to AJ, man. This would have been so much better. But even being able to call you and say, hey, how do you handle this situation? Or how, what are the little tricks you're doing to take out these teeth? Because it's like, things that I enjoy doing, I want to do, but things that I don't enjoy doing, like placing implants, taking out wisdom teeth, there's room for everybody to, have an income, but it's like helping each other out. I know you've always been willing to, to help out. And, hey, I'm using this synthetic bone. We've been using Guidor. It's been fantastic. I'll have to tell you more about that another time, but you've always been willing to like, hey, what about this? Or try this, or, you're not it's like you're not opposed to help out the GPs that refer to you and bail them out when they get in trouble, right?
Right.
As long as it's not Friday at 7 p.m.
It tends to always be on a Friday. No,
it's always.
It's we're always willing to bail people out of issues. We know they happen. I think probably the most frustrating thing for patients is that this is the classic one-liner. I've been sitting in that dental chair for 3 hours while he's working on this thing, and he finally decided to send me to you. And the patient comes in, and in about 3 minutes, I flick out the root tip that's just been killing this poor dentist. And, I think that's frustrating for patients and for dentists alike.
And that's what I'm talking about right there. That's exactly, it's like, if you can't do it as good, refer it out. And, keep learning and growing. But that's why I don't do wisdom teeth. And end of story. You can flick those out in seconds. Me, I'm digging and elevating and digging and elevating and using luxators and praying that this thing will loosen up. Sometimes it's just that way.
Don't worry. We go through the same thing.
Yeah, a little faster. Well, Doc, I appreciate you being with us today, and I hope this has been informational. I love bringing specialists on board and talking about real life experiences, and appreciate you sharing with us some of your concerns and things that you like doing, and helping out the GPs that refer to you. And I appreciate the work you do on my patients.
I appreciate that, Rob. It's a good opportunity, and we value not only our patients that come in, but also the referrals that work with us. We value good quality. We want the best for our patients, and we want to treat them appropriately. And it's a great opportunity to talk about it, and I really appreciate you having me here. Well,
thanks for answering some of those questions. Sometimes I know you don't like to, specialists don't like to answer them, but man, GPs need to hear it sometimes. And it's not about the dental insurance. It's not about the dollar. It's about taking care of the patient, and all of us getting paid fairly for what we do, and doing the best that we can, and not letting things slide by. AJ, thanks. Have a great night, and looking forward to the next continuing education course that you have at Topgolf or mountain biking, wherever it might be. Appreciate all that you do for all of us out there in the GP world. Have a great night.
Rob, thanks for your expertise, and we appreciate you. You too. And thanks for having us. We'll talk to you later.
Thank you so much for tuning into the My Practice, My Business podcast. You can find additional podcasts you may have missed that will help you with your dental practice at Apple iTunes Podcasts. And remember to become a subscriber to our podcast. Many of you have asked how to help support the My Practice, My Business podcast. If you have enjoyed the program and information you received today, the best way to help is to leave us a 5-star review. Thanks again for allowing us to be a part of your day.